All right. Hello, everyone. I'm Ryesa, and for our month 2 theme to virology presentations, today I decided to present out virology specifically from a global health perspective. And I want to give like a little bit of background or kind of introduction as to why I decided to go this route with my presentation. Given my background and interest in neurology and neuropathology specifically, I was at first inclined or like motivated to maybe choose viral meningitis or something like that, like maybe talk about a viral infection or a virus that deals with the nervous system. But as I was thinking more about it, I realized given our current pandemic climate situation that we're in, and also my public health background, it would kind of be remiss of me to not kind of take a look at virology through this lens or give this kind of a viewpoint to it. So I was really motivated to more so present from that perspective and to give a little bit more like, I guess, visual behind it. We know that virology is the study of viruses, the specific pathogens that go underneath it, and it kind of falls under this umbrella term of microbiology. And within virology, of course, there are further like subfields. So looking at the biology and like genetics that come with viruses and how they work. There's obviously viral therapeutics, and so Arvin kind of touched on that last week with his presentation. And there's a lot of, especially like up and coming research going into this subfield. There's also like viral taxonomy, so that goes with the categorization and kind of characteristics of viruses so that we may better understand them. And then of course, from more of a human health perspective and the clinical implications, there is a subfield of studying what are the disease-producing properties and characteristics of viruses. And of course, this isn't an exhaustive list of like that totally encompasses all of virology or the study of viruses, but if anything, at least from my perspective and what I've seen is that when we go into the kind of more of the nitpicky nuances of studying viruses, although these are all very, very important to understand viruses, it can sometimes sort of miss, rather than forget, it can be easy to overlook the global aspect of it. So obviously, especially again, a lot of this goes into our current pandemic situation that we're dealing with a current like viral disease that's taken over the globe. There are a lot of global implications that come with understanding and studying viruses. And so purpose of my presentation today, I kind of just wanted to re-emphasize those points of looking at the study of viruses through a global health perspective, and also just kind of reframing the conversation around that viewpoint. And so with that background and kind of brief-ish introduction, then there comes the question of why exactly do we consider viruses a global health issue? And again, given our pandemic that we're living through right now, this seems kind of maybe a self-explanatory question, but it is always good to kind of go back into the definitions and why certain things are viewed the way they are. So according to a WHO report or the World Health Report from, I believe, 2007, the WHO defined global public health security as the actions and activities, whether they're retroactive or proactive, that go into building safer environments and incorporating safer infrastructure. Specifically, this means public health infrastructure. And these activities and actions are meant to minimize the vulnerability to threats, whether these threats are environmental or infectious disease agents or sociopolitical, chemical, etc. Any of these threats that can endanger the collective health of populations around the world. So within this umbrella term of global populations, it's literally any group of people around the world that may be targeted or affected by this threat. And so by this definition, infectious diseases, especially those that are caused by viruses and have this potential to induce epidemic or pandemic outbreaks, they obviously pose a threat to global public health security. And so to touch on some more of the factors and components, especially within our current world that kind of adhere to and like fall under this definition of viruses as a global health issue, we obviously see rapid spread. And so again, a lot of what I'm going to talk about today, we're going to see it's like, oh, like we're seeing this in action right now with the current situation with COVID-19. But as we've seen, given the world that we live in, it's a very modern world. Everything is very urbanized, globalized, and everything is interconnected. The way we are able to transit information and communication within seconds, we're also able to physically transit ourselves like across the country or halfway across the world. And with that, we are able to more rapidly spread diseases, including these pathogenic viruses. And in addition to that, there's also, with the growing urbanization and interconnection of our world, there's an increased reliance on public transportation, whether that's through shipment of cargo or international trade, or using planes, buses, etc., for us to transport ourselves. And that contributes to the potentially rapid spread of viruses. In addition, viruses, especially those that cause pandemic or epidemic outbreaks, they're especially known as like non-discriminatory or indiscriminatory, in that they have the potential to affect any person within any population. This goes beyond economic or socio-political boundaries. And with implication of looking at the demographics of how viruses can affect any population around the world, then there are downstream effects to consider, such as food production and consumption. So if these viruses are coming, or their origin source is from animals or plants that we come into contact with, if the populations that are especially targeted from these viruses, they are workers who, like farmers, or workers who work in food production and consumption, or even in healthcare, then it goes on to these downstream effects of having to consider what populations are at risk here, and how that's going to affect other things along the lines. In addition, in the past 20, 30 years or so, we've already seen that with our growing world and globalizing world, there is even more rapid discovery of new and novel viruses that are coming out, or coming into light, especially zoonotic, or viruses that have origin sources in animals and transmit from animals to humans. And especially with mutations that can potentially occur in these viruses, and there's such a rapid rate of new discovery, but that also comes with unpredictability of some of these viruses. So with so many new ones or new strains that are coming out, and we see this with, there seems to be a new, I believe, administration of flu vaccine for different strains that come out every single year. So with that, it's a really big strain on researchers and medical and healthcare providers, and especially pharmaceutical providers, to be able to keep up with vaccines and be able to keep up with the severity of these viruses. And last but not least, compared to, at least from my knowledge, compared to bacterial infections, drugs and medication for viral infections are a bit more limited in terms of research and accessibility. And even though, again, attesting to Arvin's presentation from last week, there are new antiviral drugs and therapeutics that are slowly coming to the market, slowly passing clinical trials and becoming more readily available, but they are still quite limited. And I know there is a topic of antimicrobial resistance, which is similar to antibiotic resistance for bacterial infections, though I'm not going to go too far into that, only because I don't know too much about that. I just know that it is a potential limitation and an issue that is working to be combated in the research and development sector for antiviral drugs. And last but not least, there are the sociopolitical implications that come with the already limited therapeutic options for viral infections. And so, as we've seen, especially in the United States, but also like very recently, there are anti-vaccination social movements, and as well as political instability, and us being citizens, or some of us being citizens of the great United States of America, we have seen how the government can kind of add to this limitation, or government not being able to properly enforce public health safety measures, or citizens not being able to adhere to the public health safety measures and practices that are being enforced by governments. All of these can kind of contribute to the already limited therapeutic options that are available. So all of these components kind of like addressed together kind of fall again under these factors of contributing to why viruses become such a global health issue, especially in our world today. And so with global health security in mind, this is where we can start to kind of, again, viewing the aspects and components of studying viruses and virology from this global health security perspective. So, for example, going back into discovering or trying to find out what is the source or the origin of the virus. Is it vector-borne, et cetera? That goes into also what is its route of transmission, or how is it spread? Is it airborne, respiratory droplets? Is it bodily fluids? Is it extremely close human contact, et cetera? Again, there's also the demographic factors to consider. So even though, again, I mentioned earlier that a lot of these viruses that have epidemic or pandemic inducing properties or outbreak properties, they are usually non-discriminatory. They can affect any population or anybody. There are sometimes certain populations to watch out for, some populations that are of more critical concern. So I believe the example that's coming to mind is the Zika virus, which I know that there seem to be severe effects of like contracting the Zika virus, and then there are severe effects in newborn babies. So I believe pregnant women are especially a population of risk or concern when it comes to that, contracting that virus. So that's one example of that. And of course, there are the more specific like stats with epidemiological considerations. So these are the specific numbers, like case numbers, your infection rate, your mortality and fatality rate. All of these numbers and factors combine to help understand the virus a lot more, and to be able to put these factors all together in order to generate the best public health practices. And so these four that I have listed here, again, these are kind of umbrella terms. These are sort of just general concepts and components that go under public health practices, but they are things that can be sort of built around a framework to be able to deal with viral infections and spread of these diseases. And so just to touch on a couple of them, containment versus mitigation, we've especially seen that kind of put into practice, or those have been like buzzwords that have been thrown out, especially with COVID-19 spreading across the world. And just in terms of layman's term versus like the exact epidemiological definition, from my understanding of containment is more so of at the initial start of the outbreak, that is a lot more focused and emphasized on quarantining, have a spread of something, a novel virus that you're not entirely sure what are the implications of it or what's the severity of it. So containment is more so a lot more extreme enforcement of that quarantine and stopping the spread, versus mitigation is a bit more of like a long-term approach to, okay, what other like levels of infrastructure are involved, reaching out to local community leaders or schools, for example, to figure out how to open safely in the advent of a virus spreading around or an infectious disease. Washing your hands, wearing a mask, or social distancing, those are more long-term mitigation practices. And then, of course, within the realm of healthcare access and availability, there comes diagnostic testing, vaccine and therapeutic availability, et cetera, et cetera. But I will get into that in a little bit. So kind of knowing this background and this kind of perspective, looking at virology through this global health mindset, I'm then gonna try to give it some context into these global case studies. So just word of disclaimer or word of note, when I say case study, it's not really a case study. Instead, I found these review articles talking about past outbreaks that we've seen throughout the world. And each of these outbreaks, I'm kind of considering like one case to look at. So just putting that disclaimer out there. And also, before we jump into the case studies, I kind of want to give, again, a little bit of a history and overview, because when you're talking about international health law, especially, it can get a little complex and a little confusing and a little dry too. So just want to put this one blurb out here. So about the international health regulations, which I will mention later, or the IHR. So essentially, in general terms, the international health regulations are a legally binding agreement of international law between participating WHO countries, and general mission statement is to prevent, protect against, control, and provide a public health response, ensuring that all of these countries will do this in regards to an international spread of disease. And so the graphic that I have here, it's actually from the CDC, it's not from the WHO, but I thought it was a nice visual, kind of just outlining what the exact the IHR is kind of requiring of countries that are supposed to abide by it. So in general, countries are expected to detect and have surveillance systems and enough laboratories to be able to detect viral threats or potential viral threats, and they're required to assess, so be able to assess a lot of information at once and being able to make an adequate decision within an appropriate amount of time. Reporting is something that is largely like emphasized in the IHR from what I was able to read, specifically relying on countries to be able to report specific diseases and numbers, et cetera, so that is adequately communicated. And then, of course, responding to public health events accordingly. And so going into our first case study that I want to look at then, we're going to look at the Ebola outbreak from 2014 to 2016. I do want to note that I don't think this is technically correct, because on the CDC and WHO website, it says the Ebola outbreak has ended. It ended in 2016, but I am pretty sure I saw very recently, as in within the past week, that there is a new potential outbreak in Democratic Republic of Congo, like very, very recently. So that is of concern and not very accurate, but regardless. Anyways, but to go into the case that I want to discuss with the article that I read, just to refresh on Ebola, it's also considered Ebola hemorrhagic fever due to the symptoms that are created from the viral disease. It was transmitted from wild animals and to humans, and then spread very rapidly through human-to-human contact within Western African countries. And it had a pretty high fatality rate of 50%, which led it to be such a reason for concern. And looking back, the outbreak control methods that were used and like mentioned by the WHO and CDC were not very efficient. Mostly it was just case-by-case management. So as another patient came in with the symptoms, they were dealt with. And then there was some level of community engagement and trying to get people to be aware, like, hey, make sure you quarantine appropriately if you know someone who has come down with symptoms, etc. But again, it wasn't very efficiently dealt with. And there was also just early symptomatic care if you thought you had a symptom, trying to get as much care as you could within a reasonable amount of time. And so after going through that refresher, we have our, Disney Channel looking Ebola virus here, very pretty in this image. But this specific article, Heyman et al. 2015, was essentially written by a group of global health practitioners, and it was written in response, kind of retroactively looking at the response to the Ebola crisis and what had happened and what should have been done instead. And so, looking at this review article, a couple of the key takeaways that I found. First of all, they repeatedly mentioned that the Ebola crisis or epidemic was considered an unprecedented outbreak, and that it then brought again attention to the need for global health security, when looking back in hindsight, given that this was only 5 years ago, this was in 2015, when this was occurring and when this was written, this should not have been an unprecedented outbreak, given the history of outbreaks and epidemics that had happened before. The IHR regulations that were declared and agreed upon by the WHO in respective countries, that was revised in 2005. And I believe that was in response to the 2003 SARS outbreak. So no, even though this wasn't hemorrhagic fever, this wasn't analogous to a coronavirus or another respiratory disease, this wasn't technically or shouldn't have been an unprecedented outbreak. So that being said, this review article then sought to evaluate the WHO and global response, and surprise, surprise, it was a very inadequate response. And some of the key factors that led into that, just summarized from the review article, mostly it was the fact that the WHO and respective public health organizations within the affected areas, they were too slow in terms of their communication and being able to mitigate a response. And so they were unable to control the spread enough before it was spreading to other countries and other continents. And that also attests to the fact that they had improper public health infrastructure. So they didn't have the resources they needed to be able to deal with the increasing number of cases and how quickly they spread. And all of these combined, it also just attested to the fact that the WHO and these respective countries, they failed to adhere to the IHR guidelines that were set nearly 10 years and technically adapted 10 years earlier to this outbreak occurring. And so another lesson that I want to kind of highlight from this review article, and it was put pretty well by a couple of the authors, is that collective health security, or ensuring the public health, depends on individual health security. And a quote that I remember from the review article that I actually really liked is that they essentially said that improving and bettering individual health security will sum up to improved collective health security, while improved collective health security is basically the insurance and will ensure individual health security. So it's essentially talking about that interaction between understanding how improving individual health will in the long run improve collective health, and there should be more of an emphasis put on that. While the WHO and international organizations prior to this, they kind of would get stuck at this only the public global health or collective health measure, and it should actually kind of be the other way around to induce protective measures. And so what this looks like in more tangible terms in terms of improving individual health security, as summarized in this review article, is ensuring access on an individual level to certain medicines and vaccines, decreasing the individual risk. So if that means reducing exposure, and so in, again, very current terms like wearing a mask or social distancing, also improving the capabilities and ensuring that there will be rapid detection, so with diagnostic testing or timely response to cases and being able to communicate numbers of cases accurately and effectively. And from an economic standpoint as well, poorer countries need to be able to share the benefits of novel drugs and therapeutics, especially drugs that are kind of made for a rich man's market, as quoted from the article. But those are kind of just some of the key points that go into this overall improvement of individual health security to improve collective health security. And these were the main points taken from the review article about the Ebola epidemic. So going on to our second case study then, the second outbreak that I want to talk about is the MERS outbreak, or Middle Eastern Respiratory Syndrome. I will say, just a slightly tangential point, I do not like the nomenclature of MERS, given that it's a geographical assignment to a disease. It's analogous to calling SARS-CoV-19 the China virus or Ebola the African disease. I don't like it, I'm just saying. But anyways, that's one amateur scientist opinion. But regardless, moving on. So this coronavirus was identified in Saudi Arabia in 2012. It caused SARS, or severe acute respiratory syndrome, in patients who were affected with this virus. It had a slightly lower fatality rate, but still relatively high at 35 to 36%. Interestingly enough, the route of transmission from animals to human is actually not yet well known. They think dromedary camels might be part of it because camels are very rampant in this location, but that's still actually unknown, which is something I didn't know until looking into this. However, with human to human contact, it is pretty well known that it passes very rapidly and readily through very close contact. And this usually occurred during the outbreaks and with healthcare providers who would become infected by coming into close contact with infected patients. And so till now, since 2012 of the initial outbreak and discovery of the virus, there is no known vaccine or specific treatment. And something I found interesting again when looking into the background of this outbreak is that the WHO, they're on their website, their published response to this, it was very vague, and I included essentially all that they wrote here in that they said they provided updated information, updated surveillance, and then developed guidance. Like there literally was nothing else written there, like no, at least not from what I could find. So I thought that was very vague and interesting how they kind of just left it at that, and I didn't see any other protocol or anything else to kind of back that up. So that being said, moving on to specifically the review articles that I saw in regards to the MERS outbreak, these two review articles actually take place or are reviewing the outbreak in South Korea, which happened in 2015, 3 years after the initial outbreak in Saudi Arabia. And so both of these articles, essentially, I want to just summarize the key points that were taken from both of them when referring to the outbreak and what could have been prevented and what kind of went wrong with especially the outbreak in South Korea is that initially there was a lack, or essentially there was a lack of communication from the South Korean government. So the South Korean government wasn't able to communicate the severity of it to its citizens enough. They weren't able to communicate with hospitals or local public health departments. And there was a lack of communication with WHO in terms of reporting accurate case numbers and being able to communicate like, hey, this is something that's going on here and needs to be dealt with. In addition, there was a huge lack of infection control measures in South Korean hospitals. And again, this led to the incidence of a lot of the affected population were healthcare workers who did not take the proper infection control measures. You know, I guess they were missing their PPE, I don't know, but, and they got infected due to close contact with infected patients. And this also goes into the, this was kind of went alongside with the similar lack of epidemiology experts or public health experts that were in these hospitals or working on these cases in South Korea, specifically with the outbreak, to be able to have put in a word to communicate with the WHO, communicate with global public health organizations, or to even ensure these infection control measures were put in place to prevent the huge outbreak. And a lot of what happened here in South Korea is that many people would come in and out of the hospital, come into contact with these patients, take it out to other places, and there was no in time there was no real like social distancing measure or anything like that put onto this due to just like the lack of expertise on the transmission of the virus. And last but not least, there was also a mention in both of these reports how there was an overshadowing. So if you can see 2015, it was along the same timeline of when the Ebola outbreak was occurring in Western Africa. And given, of course, Ebola was a huge crisis that was dealt with and globally it garnered attention, but there is a comment to the lack of preparedness and also the failure of the WHO to be able to manage these outbreaks concurrently in two areas of the world, given that they are still both very severe outbreaks. And given that the WHO is a World Health Organization, it should be able to have the infrastructure and the abilities to mitigate and be able to control spread and at least respond accordingly to concurrent outbreaks, especially given the urbanization and rise of these new novel viruses. It is something that should be expected. So this is kind of the summary from them, this case study too of the MERS outbreak in South Korea. And MERS obviously was, you know, it's a caused respiratory syndrome, and it is a strain of coronavirus. And this was, again, only 5 years ago. It's really not that long ago. So it next brings the question of like, what about SARS-CoV-19? What about the current, not even epidemic or outbreak, the pandemic situation that we are dealing with here? So I actually introduced this as our third case study, and obviously with the review articles here, we don't really have like a retroactive like, hey, this happened, because we are still going through it right now at the time of this presentation. And so instead I found these two review articles. One is from January and one is from late March, and though they are not the most up to date, I'm sure there is another review article that might be a little more up to date that I wasn't able to get access to. But regardless, these two review articles do provide a good assessment of the current virology and current situation that we know about with COVID-19. So given the parameters and kind of concepts that I've already discussed, I just want to kind of outline where we're at now in terms of those terms. Yeah. So with where we are at now, when the WHO first announced these unknown cases of pneumonia in southern China back in December, and then the identification of coronavirus or COVID-19 was identified in December, January-ish. Since then, there has been rapid work done to identify the viral etiology, and these two papers go into enough detail about that. And obviously, there is no end-all be-all to this. We are still learning things daily now as we're going through this, but within a rapid amount of time and pretty quickly, samples were extracted and they were sent globally to labs all around the world, and they were pretty rapidly sequenced, and it was identified. And it was also identified the entry modes and the mechanisms and the transmission routes of the virus in terms of how it affects the lungs and the receptors and enzymes that it comes into contact with. And so a lot of these biochemical mechanisms were outlined in the papers, and it seems to be well understood, at least theorized well enough, and that theory seems to be well accepted. And one thing that did come out of this, and that was good to realize, especially from a public health standpoint, is that asymptomatic patients are still a source of infection, and that they still can spread the infection and spread the virus elsewhere, which is something huge to know, and it is very good to know, even though it may not be as well practiced as it should, but it is still a good source of information to know. And finally, there are also, we've learned about the clinical manifestations of the disease as it progresses in the body. And along with that, we've also identified some of the key demographics. So for example, we have learned that those with underlying health conditions the disease seems to progress a lot more severely, and we see higher mortality rates, as well as in elderly populations. So that being said, what has been done and what we've seen rapidly and been able to identify from a virology standpoint, from a public health standpoint, however, we don't yet have a vaccine or an antiviral drug. I have an asterisk here, obviously, because very recently, I think in the past week or two, is when the very recent paper came out about the possible RNA vaccine that I believe has had initial very good results in its first clinical trial and has been moved on to be administered a bit more widely. I think it's still in testing though, but I haven't read the paper yet. I don't know too much about that, but I know that there is some good news that came out of that, and there is potential for that to possibly be developed further into a vaccine that can be more widely administered. That being said though, since it's not yet readily available and there is no yet a cure for this or a treatment, the most effective task is still with limiting and controlling the spread of this virus. And along with this goes ensuring adequate communication between governments and international organizations, as well as communities, and as well as the community response in terms of adhering to social distancing and wearing a mask. And this also goes into the allocation and availability of appropriate resources in terms of hospital personnel and healthcare workers, and also just appropriate PPE and being able to provide that for patients and healthcare workers. And again, this all kind of can be summed up in that first point I made from the first case study, in that protecting individual health is key for the sake of improving collective health measures. And so looking at COVID from all of these, or this kind of perspective, I then want to kind of sum it up and sum up this presentation by saying, with all of these things considered, previous outbreaks and epidemics in the world have shown that we, and when I say we, I mean the United States, I mean the international health organizations, I mean all around the world, we haven't yet learned enough from our past mistakes and our past experiences in dealing with these kind of viral infectious diseases. And a lot of that has to do with it is obviously a complex topic, especially when you go into more of a macroscopic level of looking at global health issues, and viruses as a global health issue. But the thing is that there are protocols that can be taken place and that need to be enforced more readily. And so with that, some of the components are communication. Again, there needs to be better communication between governments, public health, whether at the local, state, or federal levels, or international levels. There needs to be better communication between public health officials, epidemiologists, experts, government officials. All of it needs to be kind of on the same page in terms of dealing with something that is as widespread as a viral infectious disease. In addition, there needs to be well-established public health infrastructure. And with that, I don't just mean clinics or physical hospital buildings. This also includes healthcare worker personnel. This includes epidemiologists and experts in the fields. This includes researchers and labs. This includes even educators about public health and educating the community, information that is spread out. All of it goes into public health infrastructure. And in addition, to ensure that these two top things, communication and public health infrastructure, there also needs to be accountability from organizations and governments, and that goes, again, the local to federal to international level. There needs to be accountability for these organizations to be able to supply this infrastructure in communication and education. And not only that, it needs to be something that is well established and put in place, not just waiting for an outbreak to happen. This needs to be something, and it needs to be established every single day. It should be something that is well developed so that at the time of an outbreak or at the time of an epidemic or pandemic, however it can just be upregulated and it can just increase its activity a little bit more rather than gathering everything and starting from the bottom up at the time of an outbreak, because at that point it's too late. It's something that needs to be further established, not like a certain 45 getting rid of our pandemic response team. But anyways, moving on. And the final component is that we need proper containment and mitigation strategies, and those need to be established and dealt with ahead of time so that they can be adjusted accordingly in the event of an outbreak. And so, summing all of this together, there isn't really a good way to just kind of put like an end all be all statement to this, because this is still a situation that we're dealing with now, and this is a situation that we're going to continue to have to deal with. And so that being said, we need just improved cooperation between governments, scientists, epidemiological experts, and just all around worldwide. There needs to be this sort of collective agreement to appropriately manage a pandemic, because we were unprepared for this pandemic and we need to not let that happen in the future. And on that somber note, that is the end of my presentation. Thank you all for listening.